On May 12, 2026, the world's top endocrinologist did something that they hadn't done in 90 years. They renamed PCOS. Polycystic ovarian syndrome is now PMOS. Polyendocrine metabolic ovarian syndrome. And yes, this is just the name change. But why is it so important? PCOS was an inaccurate name, and women paid the price for this inaccuracy. But what was the problem with the old name? It had cysts in it. Were there really any cysts involved in PCOS? Whenever we diagnose someone with PCOS, seeing the cysts on the ultrasound, these are not really cysts. These are just immature eggs. But this fact terrified women and they suffered. The old name had another problem. It put ovary in the center of the name. And what did most clinicians think? This is not my problem. This is going to be seen only by a gynecologist, and they referred. The gynecologist assessed, gave the pill and told to come back only when there's issue. But in all this, many things remain unchecked. It's your insulin resistance, your diabetes, your fatty liver, your heart, and your mental health. The new name, PMOS, polyendocrine, that means multiple endocrine organs and hormones involved. Metabolic shows that there could be metabolic syndrome involved, and ovaries where all the symptoms finally show up. Now, let me tell you why specifically Indian women suffer more. Listen to these stats. 1 in 5 Indian teenage girl suffers from PMOS. India has one of the highest PMOS burden on the world. But let me tell you one clinical scenario. There's a teenage girl who is suffering from missed periods, heavy periods, or a girl who is not able to conceive. They go to the gynecologist, and what is given to them is one Dian 35 tablet, lose some weight and come back when you want a baby. This is the generic advice that everyone gets. Once her gynecological problems are treated, she has a baby and everything is fine. She forgets about her PCOS. And 10 years later, she is diagnosed with diabetes at age of 32. Here's what made it worse. The ovary. Our families think ovary as a problem, and when you have a problem with ovary, that means you have a marriage issue. That means nobody is going to marry you. That means you're infertile. That means people are going to talk about you behind your back. So you need to shut up and keep quiet. You take a pill in silence, you don't complain, and years later you suffer with a proper metabolic syndrome. Your liver suffers, your heart suffers, you have diabetes, you have hypertension, and you are a full-fledged patient now. So what is PMOS? The driver behind this is insulin resistance. That means your cells have stopped responding to insulin. And to compensate this, your body starts producing insulin in a very high amounts. And this is called hyperinsulinemia. When this insulin acts on your ovary and your adrenal glands, both of these produce androgen. And androgen is the male hormone that gives you symptoms. Symptoms like hair fall, hair over your face, acne, and your mental health is ruined. This is a vicious cycle. Insulin drives androgen, androgen drives belly fat, and belly fat drives more of insulin resistance, and you're stuck in this loop. Here's another stat. 40%, that is 4 in 10 of Indian women suffering from PMOS already have undiagnosed metabolic syndrome by the age of 30 years. And this is shocking. Not because they did something wrong, but PMOS was misnamed, misframed, and misdiagnosed. Another important thing that Indians need to take care of is toffee, thin outside and fat inside. This is a common problem that most of the Indian women suffer from. A lot of Indian women have a normal BMI but still are suffering from PMOS, and then they are getting the advice of lose weight and everything will be fine. What do you do when you're already under your BMI?